Our health is intimately linked to the social and economic conditions in which we live. These conditions are shaped by political, social and economic forces and can create or destroy our personal health and well-being. People further down the social ladder usually run at least twice the risk of serious illness and premature death as those at the top. Socio-economic problems are now seen as health problems that must be addressed to ensure everyone has an equal chance at a healthy life. Social determinants of health include the social gradient, or where we find ourselves on the social ladder, unemployment and a lack of job security, the type of transport available to us, early life experiences which start before we are born in the form of support received by our parents, social exclusion, poverty and discrimination, the amount of control we have at work, addiction to alcohol, drugs and tobacco, stress both at work and in everyday life, the type and quality of food to which we have access, our network of social support at home and in the community. This film follows the work of 3 groundbreaking projects in Scotland, Denmark and Slovenia. Like all modern cities, Copenhagen has its share of drug-related problems, especially among the young. Drug use is closely linked to markers of social and economic disadvantage.
I've been smoking weed for 11 years, I think. 10 years on a daily basis.
Drug abuse is a very complex problem, and you have to find complex solutions with youngsters with drug problems.
U-Turn is a government-funded project set up to tackle drug use among young people in Copenhagen. Its approach is pioneering and inventive.
Sometimes we have to go behind the problem, and together with the youngsters, draw the whole picture of their life, and then with them find out where to start.
Since 2004, U-Turn has worked with drug addicts aged 14 to 25. The program aims to stop or significantly reduce drug use by providing services that address complex socio-economic determinants of health. These play an important role in patterns of addictive behavior. Treatment takes the form of day groups for 36 under 18-year-olds and evening sessions for older drug users. Attendance is completely voluntary.
They are not forced to come here. They start and come, and then the relationship grows. And then we have to make good things with them, so they want us more than we want them.
Almost the first thing we tell them when they come here is that this is on your terms. We're not going to do anything except you accept it, and you're the one who take the first steps.
The first steps are a series of individual counselling sessions where the staff build relationships with the young person and begin to unravel the stories of their often chaotic lives.
If you abuse drugs, it's because you have other problems, and therefore you have to go and work with the other problems before you can work with the drug abuse. Therefore you have to work with housing, you have to work with work, you have to work with food and the physical thing. And if they get more happy at all, they get the courage to fight against the drug abuse.
For children growing up in Copenhagen, there are temptations unique to the city. Christiania is a famous alternative community set up in the early 1970s.
There's a lot of selling weed and hash, and they have a really open-minded about it. So you can come here, smoke weed. You cannot do hard drugs at all, but smoke some hash, have a good time. I started coming here for myself when I was like 11 years old, and started smoking some weed. A lot of parents don't even have a clue what to do. My mom and dad didn't. They have no way of controlling me.
A stressful environment at home can increase the risks of drug use and addiction. So U-Turn tries to make strong links with the parents of their young clients, holding regular parent support groups.
I think it's the most important thing that we ever do in this house. We have to deal with the parents. You know, we make a strong relationship with the youngest, but we won't be there the rest of their life.
This is a well-funded project with 20 staff from a broad range of professions. Providing the young people with an education and a path to secure employment is vital, and serves to counteract the spiral of downward social mobility that often accompanies addiction.
You're not the nicest person when you have a drug addict, so you can be mean to your family. I could just go home, take the letters from the school and hide them from my parents, so it was no problem. Until they called me and I was kicked out of school for being away so much.
Education policy concentrates on a basic school qualification which all children in Denmark need before they can go on to any further training.
You can't go further on if you don't have passed that. So it's important for them, and they're so proud when they get that paper and their parents are here. It's a big party every time.
It's also a way of creating success stories in their lives. Because since we help them and manage to get them through this important exam, it's probably one of the greatest successes that we can give them.
Expressing emotions can be hard for teenagers. U-Turn finds different ways to help the young people here communicate their feelings. One approach is through music.
So they write about the problems and the dreams, and it's a different way from the way you treat this same topic in a counseling session. You should see them when he expresses emotions in music.
Hvem kan du stole på? Ved du, hvor du har dine venner hen? Hvem er hvem? Det viser sig i sidste ende. Hvem støtter dig op, når du er nede? Hvem vender dig ryggen og lader dit sind bløde? Herfra til døden.
We find it important to discuss, first of all, life. If you have a drug issue, you have it in your life, so why not start with the life?
U-Turn provides the young people with healthy, nutritious food. Just as importantly, food preparation and meal times are used to establish and strengthen peer relationships.
For some of the youngest, it's the only meal they get. It's the breakfast here and the lunch. If we should get them healthier, they have to learn to eat breakfast. They learn better in the school times. I think it's really, really important what's going on in that meal sessions. There's very good talk there about problems, about how did the weekend go, how did yesterday go.
Social isolation, the absence of friendships and support networks, has a negative impact on health. Another way used by U-Turn to build friendships and develop trusting relationships with peers is through physical exercise.
We use physical activities as a very important part of our work in U-Turn. Partly because it's important to get body working again, get fit, but also you can have a good talk where the context is completely different than the office.
These supportive relationships encourage healthier behavior patterns and are a useful tool to help combat addiction. The U-Turn project aims to tackle the root causes of its young clients' drug problems. So how do they measure success, and how successful are they?
Our success rate is that 75% of the youngsters reduced significantly or stopped drug use when they stopped the treatment program in here. Our other target is that the young people have to go to education system or to work when they leave us. And our targets, our goal is that 75% do that, and we succeed with that.
It really helped me inside to say this is a close matter in my life.